My name is Nene Takahashi. I am a third-year undergrad student here at UC Davis, and I am also a pre-nursing programming coordinator for the 12th Annual Pre-Nursing and Pre-Health Professions National Conference. First, we would like to thank the AAMC for the sponsorship for this event and allowing us to broadcast this panel worldwide. Today, I would like to welcome you all to the Masters in Nursing Admissions panel, and we are very excited to have 3 distinguished panelists representing nursing schools from across the country. During the first part of our panelists will be introducing themselves and their institution, followed by the second part of our panel dedicated to answering questions which have been previously submitted by pre-nursing students to our website and through social media. If you have any questions during the panel, we encourage you to submit questions via Twitter or Facebook using hashtag UCDPHSA14, and the most popular questions will be integrated live in our panel. To get started, if we could have our panelists introduce themselves and their institution, starting with Dr. Debbie Lindell, then continuing down the line.
Hi, good afternoon. I'm Debbie Lindell. I am from Case Western Reserve University in Cleveland, Ohio, where it is fall now and the leaves are dropping, and we had frost last night, so we get all the 4 seasons. Case Western Reserve University is a research-intensive university in the beautiful neighborhood of University Circle in Cleveland. We have an undergraduate student body of about 5,000 students, and then we have an equal number, approximately, of graduate and professional students. And we have medical school, dental school, and nursing school in the health professions. Within our nursing school, which has been endowed since 1923, we have a number of degrees from BSN undergraduate through master's to doctoral, DNP, PhD, and DNP combined with PhD for those that want to be in school for a long time. Today I'm going to talk a little bit about the master's program, since that's what this session is about. We offer 2 master's degrees. The first one is the program that I direct, which is our graduate entry program designed for individuals who already have a college degree but not in nursing. They're also referred to as direct entry programs, master's entry programs. There's a number of different names for them. We call ours our graduate entry. Our students are admitted and enroll once a year. We do rolling admissions, but we start 1 class a year in the fall semester. And the students are admitted for 2 phases of the program. The first one is to become an RN, and that one is 2 years long. And during that phase, the students prepare as advanced generalists, earning 16 credits towards the MSN degree, which is our advanced degree, which I'll get to, and a concentration in continuous quality improvement in healthcare. So once they finish the MN degree, they can move on permanently, forever, get their license as an RN. They can move directly on into our MSN program and prepare as a nurse midwife, one of many different specialties we have in nurse practitioner, and as a nurse anesthetist with a separate admission process for that specialty. And we also have a nurse educator option as well. The student can also work for a couple of years and then come back into the MSN program, part-time or full-time. So at the MSN level, it's very flexible. And then they can decide if they want to move into doctoral study for the DNP or the PhD. We do have a direct MN to PhD scientist degree. Our admission requirements for the MN phase, the graduate entry, are basically the same as the MSN and are clearly stated on our website, minimum GPA of 3.0, and we do natural science and behavioral science GPAs of 2.75, GREs 150, 150, and 4.0. And then we have a number of prereqs, which are like all second degree programs stated on our website. The MSN program has similar admission requirements except for the prereqs. So I think that gives a pretty good overview of the school, and I will turn it over to my colleague from the University of Virginia.
Thank you very much. My name is Clay Hysell. I'm the Assistant Dean for Admissions and Financial Aid at the University of Virginia School of Nursing. We've been around since 1901, so we're 110 plus years. I consider ourselves a full-service nursing school. We admit students directly from high school into a 4-year BSN. We have multiple MSN pathways, and then we also have PhD and a DNP. For our MSNs, we have 2 primary areas. One is for students who have bachelor's degrees in other areas. So that would be an MSN for non-nurses. We call that a direct entry, so similar to the graduate entry and other types of programs like that. That's a 24-month, full-time, intensive program with about 1,000 clinical hours, of which most of them are precepted one-to-one. There are some group, but most everything there is one-to-one. Students are prepared to sit for the RN exam at the end of that, as well as the clinical nurse leader certification. Then we also have MSNs for those with bachelor's degrees in nursing for acute care NP, family NP, psych NP, and pediatric primary care NP. And then we have DNPs and PhDs, where we both have the BSN to PhD and DNP, as well as the master's to both doctoral degrees as well. We recently received a large gift from an outside foundation so that we are growing our direct entry program. We are doubling the size of it within the next few years, and we've added a second site where we'll be doing instruction in Appalachia, in Southwest Virginia in the coal fields, because that's an area of our state where there is a great deal of need of healthcare professionals of all types. So we'll be taking individuals who are from that area, providing them education, so they too can become the nursing leaders to help the individuals there in Appalachia. And then the third part about that large gift is we received a number of full scholarships for students with backgrounds of working and volunteering with the underserved, so they can then graduate with no debt. I'll now turn it to my other colleague.
Hi, I'm Deirdre Hughes. I am the Associate Director of Admissions from the George Washington University School of Nursing in Washington, D.C. George Washington School of Nursing has not been around as long. We became a school in 2010. We're the newest school at GW. But it doesn't mean that GW did not have nursing programs. We were a nursing department under the med school, and we grew so much that we were eventually able to become our own school. We have several masters in DNP tracks. We have a master's in family nurse care, family nurse practitioner, adult gerontology, primary care nurse practitioner, healthcare quality, which is for folks who are interested in improving quality in healthcare, nursing leadership and management, and people who are interested in healthcare policy, and particularly with the Affordable Care Act, are really wanting to be involved in policy and advocacy in healthcare. Our DNP tracks include a family specialty for someone who's coming to us who already has an NP in another area. We also have executive leadership, nurse educator, and a general track for folks who are just looking to expand their education. In addition to that, we also have several postmasters certificate programs and all of our NP programs in healthcare quality.
Thank you. So to move on to our first question, we'll start off with Dr. Deborah Lindell and continue down the line. So what is the difference between NP and MSN degree? And does an applicant have to obtain the MSN degree before getting an NP degree?
Could you say it again?
Mm-hmm. What is the difference between NP and MSN degree? So that's the first question. And the following question is, and does an applicant have to obtain the MSN degree before getting an NP degree?
Okay. Excuse me. The MSN is an academic degree, and schools of nursing can award different graduate degrees at the master's level. The Master of Science in Nursing is the most common. But as I said, we have an MN, there are MAs, there are MS in nursing, there's several different ones, but MSN is most common. Nurse practitioner is a major that someone would do while earning the MSN degree. So at that level, you choose a specialty. And my colleagues mentioned a number of different ones. We have a number of different ones. But a number of them do lead to becoming a nurse practitioner. In order to practice as a nurse practitioner, in most states you do have to have the academic graduate degree, but you also need to be board certified in your specialty and then also apply to the state that you are going to practice in, where you would already have an RN license for whatever credential they require to practice as a nurse practitioner. So one is a credential to practice, and the other is an academic degree. And I'll let either of you, if you want to clarify.
Yes, so one is a degree, one's a certification. If I can add one thing to that, currently in the 50 states, one needs at least an MSN degree to be able to sit for an NP certification, or a clinical nurse specialist, or a CRNA, or a clinical nurse midwife. It's possible to do that also as a postmaster's or as part of a DNP, but you need at least a minimum of an MSN currently. That's likely to change. Nursing education is in the process of evolution, so we will see, but currently only the anesthetists have made the doctoral a requirement after 2025.
Can I say ditto? You know, for instance, at George Washington, if you have an MSN in something else, you can still go back and get that postmaster certificate in nurse practitioner. Again, like my colleagues have said, you know, that MSN is the part that you need in most states, and then you can take the certificate or sit for the certification exam.
Thank you. So the next question is, what is the outlook on job stability and job availability for those entering nursing schools in the next few years?
I'll start it. I would say, since I'm in Charlottesville, Virginia, in that area it is very, very strong. We have a 625-bed level 1 trauma center that is always looking for new graduates as well as APRNs and experienced nurses. There's a strong need for quality health care, especially now with the ACA, and I would anticipate that to continue over the next few years. If one has a certain dream of a hospital, you need to be at a certain particular unit, a certain particular city. There may or may not be a job 24/7, 365, but entering nursing, there are jobs out there for you that are very intriguing and very captivating.
I would say with the ACA Act, that nursing is expanding. It's become important. It's become critical to everyone as we proceed along. So I would encourage you, if you're looking for a job, to keep your minds open, because sometimes some areas have more nurses and some areas, you know, as rural areas, don't have enough. So as long as you're willing to be flexible and willing to move and keep your options open, there will be a job for you.
And I would say ditto too. In the Cleveland area, we also have medical centers that are expanding, and we're kind of in a strong medical area, but in the hospitals, they have been rapidly hiring nurse practitioners into hospital-based advanced practice. And then with the Affordable Care Act, it's opening a lot more opportunities for primary care as well. And I have to say, talking about flexibility, I had a student graduated from the MN program last year, and she wanted to work in critical care so she could prepare to go to nurse anesthetist school. And she moved away from our area to the Phoenix area, excuse me, before she graduated, so she was committed, and found that it was kind of difficult to get a brand new RN job in critical care. But she wound up working for the Indian Health Service north of Phoenix in a very small hospital with just 20 beds, and I visited her just recently, and she absolutely loves it. And that's a door that opened that she never would have expected. She had been a surgical assistant for many years in fairly large hospitals, mid-career changing, and she just is so drawn to this hospital now. She doesn't anticipate leaving, and she's actually applying for an appointment with the health service, which will help remediate her tuition.
Thank you. The next question is, it was a very popular one. What makes an applicant stand out in comparison to others?
When you're looking at applications and you're looking at, hundreds, sometimes in thousands, depending on the program you're applying to, what stands out may seem like common sense. Did you follow the directions? Did you complete the application? Did you submit it on time? All those things which, like I said, would seem like common sense, but you'd be surprised at how often we see incomplete applications. So, with that in mind, the things that stand out at GW are, well-written applications, a passion and commitment for nursing or whatever program you're applying for. So if you want to apply for our family nurse practitioner, we want to know that you have a vision for being a primary care nurse practitioner. Making sure that you get good recommendations and that they can speak well of you and your skills so that we can make an informed decision. GW does not require GRE, so we're not relying on test scores. We're relying on your grades. We're relying on your personal statement and your resume. So we read the full file, and we're looking for those things.
I would say generally we're the same way. We do rolling admissions for our graduate programs, so we look at each applicant individually against our admission requirements that we're very clear about. And so we're really looking for someone who can, we believe, succeed academically, but also has a strong understanding of where they see themselves going. We don't require that our graduate entry students commit to a specific major coming in, which some schools do, and everybody has their reasons. But we are looking that if someone has considered medicine or pharmacy, that they explain, what the difference is and why they've chosen nursing. And for our program, that they understand the difference between the RN role and the advanced practice role, because they're potentially going to learn both of those. So it's that ability to show that you've done your due diligence. These are huge commitments, and we want to make sure that the individuals have really prepared well.
Thank you. Oh, sorry, we aren't actually taking questions right now, but maybe probably at the end of the panel. Thank you. So the next question that we had submitted online was, how heavily are extracurricular activities, clinical experience, or organizations, how heavily are they weighed when being considered for admissions?
I'll just try this first then. In terms of our master's entry program, we have individuals coming to us from a variety of backgrounds and a variety of levels. Some people are applying to us straight from undergrad. Others are coming to us after 1 to 25 years in the professional world. We're very holistic review, so we look at professional work experience, exposure to healthcare, as well as recommendations, essays, and grades. For those who are entering nursing, we do want people who have had something that is more hands-on relating to healthcare delivery. That could either by being a patient. We had one student a couple years back who had a heart transplant, and he certainly had spent 250 days, over a year and a half, in a hospital bed. He knew an awful lot about healthcare in that respect. We have others who have been caregivers for family members, and others who have been medics overseas in the military, as well as people who have done great mission work. So there's no one thing that we're looking for, but we do want to understand what nursing is, what healthcare delivery is, and to have that passion for it.
I would say that I concur, and we too look for those types of experiences. How have you informed yourself about the nursing profession? And do you have a good understanding of what's going to happen the first week of school when, in our program, you will be in a uniform in the hospital working with the patient? So, do you really understand, what that involves? In advanced practice nursing, whether you have, no matter what level degree that you have, all the way up through the PhD, you are always a nurse first. So you have to be prepared to move through that process so that you can become immersed in the values and beliefs of nursing, as well as being competently prepared to move on to advanced practice.
This is another ditto. In addition to all of that, in terms of the students who are coming to us who already have BSNs and are looking at our graduate programs, definitely your work experience weighs the most. We don't require work experience, but that is something that, particularly at the DNP level, we really need to see. Is we need to see how much experience you had, how committed you are, how well you're doing in that area.
Thank you. The next question is, what are some common errors that applicants do during the admissions process? Some errors or mistakes that they make during application process?
I'll start and then. Well, it was already mentioned about incomplete applications, last-minute applications. I mean, we do rolling admissions, but April 1 is kind of our drop-dead date for the following fall. And nowadays with electronic submission, we see the time stamp on it, and I've literally gotten some at 11:59. And not all the parts and pieces are there. Just because the application form itself is there, there's other parts and pieces to make a complete application. I think another thing, too, is the personal statement. Not only the content of it, which we've been talking about, the types of things that are appropriate to include, but the quality of the writing is another thing to think about. And I have to honestly say that when I see the word medical used throughout an essay, that often tells me that that individual may have been looking at medicine, and that is fine with me. We're glad to have anyone in nursing who wants to be there. But medicine is not the same as healthcare. Nursing's a part of healthcare, but medicine is medicine. And so it doesn't mean the person won't be admitted, but when I do the interview, we circle that. As I review all files initially, and then they go for interviews, and we do actually circle and highlight those kind of things to talk about them during the interview.
I also read and evaluate the freshmen and the transfer applications, so I look at an awful lot of them. And the most glaring mistake that I've seen every year, unfortunately for the past several years, is people who attach the wrong essays. So one of the questions is, why nursing and why UVA? And one memorable essay was, when walking across the quad at Wake Forest, I felt like I was at home. I'm glad, but it's hard to persuade me to admit you to my university if you've already told me in your essay that you want to be someplace else. So if your application has places to upload resumes, essays, double check and make sure you did upload the right one.
I will say the biggest mistake I see is in letters of recommendation. We require 2, and I really encourage applicants to spend some time, choose your reference wisely. I have seen references that were literally 2 lines. Joe Smith is an excellent student. He picks up the phone quickly, and he's very nice. The end. That doesn't tell me anything, and when I don't have anything else to rely on, if I don't have GREs or anything, and we're looking at a holistic application, I really need a reference to speak about you and your skills and what you can do and what you're going to offer the field of nursing and GW. So spend some time, choose wisely, and don't ask them at the last minute because they may not have the time to do it. You know, your references are just as busy as you are, so be respectful of their time as well and give them as much lead time as possible to get a good recommendation for you.
I think that's a very good point, and along the line of references, which we also get references that say, this person would be great for PA school, or this person. Now, we do give them a little break on that since, you know, they may have lost track on the different things this person was applying to. But it's really important to nurture individuals along the way that you feel comfortable with and that you take time to get to know, and that doesn't mean walking right up after class, but going and meeting with these individuals during office hours where we sit all by ourselves waiting for someone to come and meet with us. It's really important because I hear fairly often, well, I lost track of these professors, and now, we require a minimum of 1 faculty reference and no personal references. And so, you know, people will say, I don't know what to do. And, well, now they're taking prereqs in a class with a whole lot of people, and in a community college or something, I say, you got to get to know that person, tell them your goals, because somehow you have to get a faculty reference. So keep that in mind and nurture that along the way. When I applied for my doctoral program, I got a reference from someone from my master's program from many, many years before, but I had kept in touch with that person. And they, you know, you remind them what you're up to, you send them your resume, and tell them what your goal is, and many times they want to help you succeed, and they'll help you out.
Thank you. So the next question is, does an applicant be better off to get an BSN, work for a while, then get an MSN through part-time study?
For the individual who already has a bachelor's degree in something else, I would encourage them to think about going on for a master's or directly. There's been some major changes in federal financial aid, which makes it more difficult to receive financial aid for a second bachelor's degree, especially if you received aid for the first one. So there are many schools that offer master's entry, graduate entry, direct entry programs. And if you have the passion to go on further and you think you might need support to pay for it, consider going on for the master's entry. Now, if Bill Gates happens to be your uncle and he's willing to write you a blank check, then your sky's the limit. But otherwise, financial aid may become a motivating factor for the next degree to pursue.
I agree.
Agreed.
Okay, next question. How flexible are instructors when it comes to family, full-time jobs, and other responsibilities outside of school?
I would say it depends on the program. For instance, GW's graduate programs were set up and designed for part-time study, and we strongly encourage students to do that. That way you have the time to, you know, tend to life, because life happens whether you're in school or not, and, you know, you need to take care of your family, and you need to, you know, do those things outside of schoolwork. So with that, you know, a part-time program is definitely a way to go if you're juggling family and other commitments.
Yeah, I agree. For our MN program, the pre-licensure part of our graduate entry, it is a full-time Monday through Friday program with classes 2 days a week all day and clinical 2 or 3 days a week. So our students are very well informed during the interview process and the application that we don't recommend working. We recognize that students work, but it needs to be a very limited amount with flexible hours. In the MSN program and the DNP, there is more flexibility for part-time or full-time, you know, study, and more options in that regard.
Ditto.
The next question is, what are some financial aid awards does your school offer?
I can start.
Go forward.
In the MN program, again, there is some increasing financial aid, but at this point, during the pre-licensure part, other than some scholarships that we have that are awarded on admission, if the individual's going to be awarded one, they're notified in the admission letter, is largely subsidized and unsubsidized loans. In the MSN program, we have more opportunities through whatever we're able to get with traineeships and other federal funding. Our school does have an educator track in the MSN and the DNP, and currently we have the nurse faculty loan program, which is extremely supportive. It's an 85% loan forgiveness. The student does not have to pay the tuition up front, but they do have to work 4 years full-time as an educator. And for students who come out of an MSN program with an NP and need to get their prescriptive authority, they have to keep that in mind. You can only do so much at one time. And in Ohio, the State Board of Nursing requires 2 years' experience as an RN before someone can work as an educator. But for our experienced RNs who are looking to become educators, the nurse faculty loan at the MSN or the DNP level is extremely attractive and very popular.
For us, it really varies as to the program. We're in the very fortunate position to provide all of our PhD students with full scholarship for 2 to 4 years. And that does require full-time study. For our DNP students, those who are full-time, I would say 85% of them are receiving full scholarship and they're working as graduate teaching assistants with us. For our master's program, we have a number of partial scholarships, but many of them are full-time employees and therefore getting support from their employers because they're working full-time as RNs. And for our master's entry program I mentioned earlier, thanks to an outside grant, this year we have 14 students who are receiving $20,000 scholarships. Next year we intend to add an additional 10 in the entering cohort who will receive also $20,000 scholarships per year for the duration of the program.
As GW continues to grow, we continue to add more and more scholarships to our what we offer students. Right now, our DNP nurse educator track, we have a grant from Care First in which that grant will cover the full tuition plus a stipend for one student who's interested in becoming a nurse educator after they graduate. With that, we have some grants from various locations for specific tracks, adult gerontology, and others, but most, again, as it was mentioned before, a lot of our students in the grad programs are part-time and are working and have their employers funding their education, or that they're paying out of pocket because they are working.
Thank you, and sorry for the flies bothering you. The other question is, what experiences in college or grad school were most helpful when it came to applying to nursing school? This is a personal question.
I'll comment. I think we've kind of spoken about that, but it's we look for a commitment to service, some type of service that can be done in many different ways, and then doing the due diligence to get experiences to inform oneself about nursing and what the profession is about. That can be done in different ways, through volunteer, through employment, as a patient, or maybe a family member has been, that you've worked closely with who has been ill. But we just really want to understand where this individual is coming from and where they see themselves going, and if that's a fit with what we have to offer.
I would say the one thing that has been attractive to our faculty are individuals who are spending long time commitments in particular activities rather than shadowing 2 hours here, 4 hours there. Things that have been very popular for our entry-level pre-licensure students are we've had a number of folks come to us who've been CNAs, LPNs, EMTs, or volunteered with the Alzheimer's Association for months or semesters at a time. That's been very attractive because it's shown not only a long-term commitment, but also doing things that are hands-on, helping others in need.
Our grad programs, because all of our students in our grad programs are nurses already, that it's basically work experience, you know, what you're doing and, you know, where this GW degree can take you. So that's what's really important. It's just what you're doing now.
Thank you. Next question is, which is preferred to have a CNA or a medical assistant certificate before applying to MSN programs?
Some schools, well, if it's for an entry-level master's program of the type that we have, some schools do require a nursing assistant certification. As I mentioned, we do not, but that certainly is one way to inform oneself about what nursing is about. At the MSN level, where nurses are coming in, where they're already registered nurses, then we would be looking for appropriate experiences as an RN for certain of our majors. The critical care majors and nurse anesthesia all require experience as an RN in different types of settings. Our primary care majors, we don't require that.
Nothing further to add from me.
Nothing else.
Okay. So because we have a couple of minutes before we end this panel, I would like to open the rest of the panel to any final advice you have for future applicants or the audience here.
I'll start, and I think I would say that one of the things that we've been kind of observing as our students come in to nursing into my program, where they have their college degree and they've decided to enter nursing, is the importance of being aware that today's nurse is a part of a healthcare system. And at the RN level or the advanced practice registered nurse level, you do care for or manage the care of individual patients. If you are a nurse practitioner, nurse anesthetist, nurse midwife, or an RN. However, you function within a system, an organization and a system. And today's nurses have to be aware of the influences of that system on the care of their patients, individual patients, the microsystem, the unit in which they're working, and be able to participate in quality improvement activities and look at the bigger picture. It's not about, you can't just come in and care for your individual patient today. You have to have a sense of what's going on from a system perspective and how that's affecting the care of the patient individually or on the unit.
Added to that with the system, which is very important, is that you're also part of a team, so that you're not there by yourself operating to care for your patient. You are working with medicine, with nutrition, with OT, with PT, with pharmacy, all together with the goal of improving the outcomes for that patient. And thanks to ACA, that when they are discharged, they'll not be readmitted within 30 days. But it's important to work with others and to anticipate problems so that you can work in the system well for the betterment of your particular patient or patients.
Adding to that is that nurses are important. You know, I've heard, you know, a lot of students trying to figure out, you know, should I do this or what about medical school? Nurses are important. Like for me personally, if my doctor was sitting front row, I wouldn't know what he looks like. Why? Because I see a nurse practitioner, and they're becoming, you know, increasingly, I would say almost like the linchpin, you know, critical part of that team that is going to help, you know, keep America healthy and moving forward.
Thank you.
I agree. Today's, just kind of putting it together is, in today's healthcare system, it is the patient who is at the center of the team. And everyone works together with the patient and their family to help the patient achieve their goals at whatever point they are along the health illness continuum. And I totally agree with the points of my colleagues that it's a team effort and it's working within a system to help people be as healthy as possible.
Thank you. That will be all for the questions that we have today. Please give a round of applause to our panelists and their very informative answers.